Hi everyone. Welcome back to English for Nursing with me, Maya. In this session, we're going to learn about discharge communication planning. So this is about the communication between patient and nurse when they are going to be discharged. So basically, this is a good news that you are going to tell them. So what are the patients feeling when they are going to be discharged? They may feel relieved and excited, but nervous at the same time about being at home because there will be lack of support from the nurses. They may also be worried about the ability to take care of themselves. And then they'll be having a lot of questions that they might be hesitant to ask the nurse. Therefore, we're going to learn about discharge communication planning to create the environment where the patient's family, clinicians, and the nurse work together to support the patients better when they are at home. Discharge communication planning is all about involving the family members. So we need to create an environment where patients, families, clinicians, and hospital staff all work together as partners to improve the quality and safety of hospital care. Since family members will be the one acting as the healthcare team when later the patients are discharged, we need to involve them as a member of the healthcare team and also the advisors to improve the policies and procedures. This is why it is not one-time event, but it's a whole process when the patients and the family are still in the hospital. In the discharge communication planning, everyone plays the roles, like their family and the nurse, the doctors, and the clinicians. Later, when they are at home, this whole task will be done by the family member, while the doctor will give order for discharge, communicates clearly with other team members, including the nurses, patients, and family about discharge plans and next steps. So what will we do to improve the discharge planning process better? We're going to learn about the strategy in ideal discharge planning. Well, basically it's called IDEAL. IDEAL. I stands for including the patients and family as partners. D. Discussed with the patients and family 5 key areas to prepare problems at home. E. Educate the patients and family through how the hospital stay, which would say this is not a one-time event but the whole process. A. For assess how well the doctors and nurses explain the diagnosis conditions and the next steps in the care and use the teach back. L is to listen and to honor the patients and their families' goals, preference, observation, and concern. And yeah, we're going to start elaborating one by one from the ideal discharge planning. So I is including the patient's family member in the conversation as a full listener. Basically, in this kind of steps, whatever the treatment you are giving to your patients, make sure that their family member are around to listen. This is important because later when they are discharged, the family member will be advocating your patients so they will be providing the care. That is why they need to be in the conversations. Please make sure also that they understand what you are talking with the patients to make sure they get exposures about the treatment and then add for discussion. Next, Discuss with the patients as well as the patient's family member 5 problems that might have been at home. Again, we remind you that this discharge planning is not one-time process, but the whole process. So the first key area is describing what life can be at home, what could be eaten, and what cannot be eaten, and the complications of the disease we are contracted. The next one is reviewing the medications. What kind of medicine, what is the dosage, what time they should eat the medicines are the informations that you should tell them in this part. Next, highlight some problems. So if some specific condition comes up later, you need to tell them about who we called and what to be done. So at the part of the situations, they will not be panicked, but they know what to do and to take care of the patients better. Next one is to explain the test result. When explaining the test result, make sure the patients and the family are listening to you. However, if the test result is not available at the day of discharge, you can consult with them about when they could come to take the test result. Last key area is to make the follow-up appointment. Basically, as an urge, you need to over them about the follow-up appointments to make sure that they will need the control after even being discharged. This process needs to be taken regularly to make sure that their condition is getting better. The next one is E for educating. In this part, you educate the patients and family about the patient's condition, the discharge process, and the next steps at every opportunity throughout the hospital stay. I'd like to emphasize that this is done through the day at last at the hospital because basically you are telling the patients and the patient's family about every detail of the care that you're giving, including when you are administering the drug, you tell the patient's family what kind of drug it is and then how many to take and what is the functions of the drug as well as the first time when they come to the hospital. The last one in educating is you basically are encouraging the patients and the patient's family to actually look at how to provide better support to the family member itself. So in this assess part, we're going to listen to them about what do they understand from the diagnosis and what do they understand about what next steps do they need to take when they are taking care of the patients. Basically, we can actually provide the information in small chunks and then ask them to recall what they know about the information. You can also ask them to repeat back when you saying to make sure that they already understood the whole information that you've been telling them during this day. So the last one is L, that is listen. You need to listen and to honor the patients and the family goals, their preferences, observations, or probably concern. In this part of the process, you could actually invite them to write their concern on the board provided for them, or you can just open up for an open-ended questions by giving them time to ask questions. This is very important because they might not understand what you've been explaining before. By giving them the space, they will be better open at you. Now, please read this model dialogue. That's all for today. Thank you for watching. Have a nice day, everyone.